Hello, I'm Dr. Jennifer Shuford, Commissioner of the Texas Department of State Health Services. Here at the state's Public Health Department, we've spent the past few weeks responding to the measles outbreak in West Texas and wanted to answer some of the common questions that we're getting from people both in that area and across the state. First, we want to share the basics about measles and how it spreads. Measles is often associated with a rash, but before the rash appears, patients typically experience fever, cough, runny nose, sore throat, and red watery eyes. After a few days, that telltale rash develops, usually starting up at the hairline and then going down the body. The person might also develop bluish-white spots in their mouth called Koplik spots. And you should know that measles is highly contagious and can survive in the air and on surfaces for up to 2 hours. The good news is measles is a vaccine-preventable illness. 2 doses of MMR vaccine are 97% effective at preventing measles. The measles outbreak is currently centered in the South Plains region, mainly in communities with lower immunization rates. If we can encourage enough people in those communities to get the measles vaccine, we can keep that outbreak contained. Now, you may have heard about a few other cases that have popped up around the state. I assure you, this is not unusual. Those cases usually happen when someone contracts measles while traveling outside of the United States. When they return home, they're usually coming back to a community where nearly everyone is vaccinated. Because so many people around them have immunity, those cases don't usually spark a large outbreak. However, in communities with lower vaccination rates, large outbreaks can occur. Right now, we know it's concerning for all Texans, especially if you're traveling soon. Again, the best way to stay safe is with 2 doses of that MMR vaccine. If you suspect that you or your child has measles, it's important to get tested as soon as possible. Tell your healthcare provider you might have measles before you go in so they can keep you separated from other patients. They'll evaluate you and decide whether testing is needed. Until that test result is known, anyone who may have measles should avoid contact with others as much as possible, especially with people who aren't vaccinated. Stay isolated for at least 4 days after the rash appears. Measles can be serious, even deadly. So if you think you have it, it's important to get medical care as soon as possible. And in certain cases, you may even have to go to the emergency room. Closely watch a baby or young child with measles for danger signs. Trouble breathing or a bluish color around their mouth could be signs of pneumonia. Crying without tears or decreased urination could mean they're severely dehydrated. Any of those are signs to get them to the hospital. The same goes for having a seizure, unusually low energy, or a severe loss of appetite. For adults, the warning symptoms are similar to what you would see in kids, but they might look a little different. Watch for fast breathing or difficulty breathing, decreased urination, confusion, headache, decreased alertness, or severe weakness. These are all signs to get emergency care. Call the ER right away and let them know that someone with measles is coming in. If you were born before 1957, you likely had measles and have immunity. If you were born after 1957 and don't have your vaccine records, contact your primary care provider. School nurses may also be able to help with vaccine records for those school-age kids. Here at DSHS, we are committed to protecting the health of every Texan. You can find the answers to these questions and more at dshs.texas.gov/measles. With your help, we can curb this outbreak and protect the next generation from measles. Thank you.